Is micrographia a sign of disease progression? Have you ever wondered if micrographia, the condition where handwriting becomes abnormally small, is a sign of how Parkinson's disease is progressing? Micrographia is a common symptom in people with Parkinson's disease, affecting about 50% to 66% of individuals. It often occurs alongside other motor symptoms like bradykinesia, which is the slowness of movement, and hypophonia, or soft speech. When we look at micrographia and its relationship to disease progression, things can get a bit complex. Progressive micrographia refers to handwriting that gets smaller as a person continues to write. This change is linked to impaired motor control due to Parkinson's disease. However, studies show that there is no strong connection between this progressive form of micrographia and overall motor disability or bradykinesia scores. This means that while micrographia is a noticeable symptom, it does not directly indicate how severe or advanced the disease is when measured by standard clinical scales. On the other hand, consistent micrographia, where handwriting remains small throughout a writing task, may be associated with more severe motor symptoms and bradykinesia. This suggests that consistent micrographia might reflect a greater level of motor impairment. The reasons behind micrographia can differ between its progressive and consistent forms. For instance, consistent micrographia is often linked to decreased activity in the basal ganglia motor circuit, while progressive micrographia may involve dysfunction in other brain areas, like the supplementary motor area and cerebellum. Interestingly, micrographia can appear early in the disease and sometimes even precede other motor symptoms. However, just having micrographia does not reliably indicate how the disease is progressing overall. It is important to remember that while micrographia is a common symptom of Parkinson's disease, progressive micrographia itself is not a definitive marker of disease progression. Instead, it highlights specific motor control issues related to bradykinesia and basal ganglia dysfunction. In practical terms, recognizing micrographia as part of Parkinson's disease can help in managing symptoms and tailoring treatment strategies. Treatments might include occupational therapy and methods to improve motor function and writing ability. However, these strategies do not change the underlying course of the disease. Understanding micrographia's role in Parkinson's disease helps provide a clearer picture of the complex motor symptoms involved. Always consult with healthcare professionals for personalized advice and treatment options.